Hello everyone, in today's video I'm going to be demonstrating how to report observations relating to drains to the nurse. After a surgical procedure, health practitioners realize that post-operative patients require as much care as they did before surgery, therefore they have to be monitored and observed carefully. A drain is used to remove fluids such as pus or blood from the body after or before surgery. A drain outlet may be a catheter, tube, Jackson-Pratt grain, Seagram's grain, or Penrose grain. As we all know, before attending to a patient, we have to observe proper hand hygiene by washing hands properly and putting on gloves. Now, I'll be showing a short demonstration on how to observe a patient's drainage. I'm going to be checking your drain today, which is your catheter. So I'm going to check some of your vital signs and just to confirm that everything is going on perfectly. I'm allowed to do so. Thank you very much. So I'm going to have to check the sides first. Now I'm checking the area of the skin where the catheter is being inserted in order to confirm if there is any form of discoloration or any form of fluid leaking from the outlet. And from what I can see, everything is perfect. And so the next thing I'm going to check is the catheter and its insertion to the urinary bag. Fantastic. So, okay. It is intact. But from what I can see, the patient has not urinated in the past 24 hours, and this is a major concern. So I'm going to have to report this to the nurse. The color of urinary output is something I'm also supposed to check, but since the patient has not urinated in the past 24 hours, I will not be able to determine that. So I also have to inform the nurse about this. What I just did was to take the pulse of the patient in order to determine if the patient has tachycardia, which is when the heart rate of the patient is higher than normal. And from my observation, I can see that the patient has a heart rate of 120 beats per minute, and this is considered high. So I have to report this to the nurse. The heart rate has also given me a rough estimate of what the blood pressure might be. This shows that there is a chance that the patient has a high blood pressure, but I also have to confirm that in order to be properly sure. I also need to take the patient's temperature to confirm that the patient does not have a fever. And in case the patient's body temperature is higher than normal, I'm also going to report this to the nurse. From what I can see, the temperature of the patient is perfectly normal. All my observations. I will see you in a few hours, okay? Take care of yourself. If you need anything, please let me know. Now that I've made all the necessary observations, I need to ensure that I document them properly and report to the nurse. So, I have checked the patient's temperature, pulse, blood pressure, the urinary output of the patient, the surrounding skin around the drainage, the intactness of the drainage, the color of the drainage, the amount of the drainage. This information will help the nurse to make conclusions about the state of the patient. As I have seen, the patient has a high heart rate, a high blood pressure, her temperature is normal, a low urinary output, and the drainage insertion is perfectly fine. This can help us to make a conclusion to whether the patient has an underlying sickness or if there were any complications that arose as a result of the surgery. Drains are portal entries through which pathogens can enter into the body, so we have to take proper precautions while assisting with the drains in order to prevent infection. Thank you for watching.